Hiking and glaucoma, terrain, altitude, and sun exposure. Hiking can be a great way for people with glaucoma to get exercise and enjoy nature, but it also raises questions about eye pressure, blood flow to the optic nerve, and safety on the trail. In general, moderate aerobic exercise like brisk walking or hiking is beneficial. It strengthens heart and lung function, helps control blood pressure, and can improve mood and stress resilience. In fact, a recent review found that outdoor hiking improves cardiovascular health and also alleviates stress, improves mood, and enhances mental health. Higher overall fitness has even been linked to slower glaucoma progression. However, hiking also brings challenges. Long treks can lead to dehydration, strong sunlight, and difficult footing. Importantly, for glaucoma patients, we must consider whether hiking acutely affects intraocular pressure, IOP, or ocular perfusion pressure, OPP, the pressure that drives blood flow to the optic nerve. Below, we review how moderate hiking and altitude changes influence IOP/OPP, weigh the health gains against eye risks like dehydration and UV exposure, and give practical advice on gear and pacing. We conclude with criteria to help decide if a high-altitude hike is safe with glaucoma. Hiking's effects on eye pressure, IOP, and eye blood flow, OPP. Intraocular pressure, IOP, is the fluid pressure inside the eye. It is the main modifiable risk factor in glaucoma. Ocular perfusion pressure, OPP, is roughly the difference between blood pressure in the eye's arteries and the IOP. It represents the force driving blood through the optic nerve. Low OPP, for example, if blood pressure drops or IOP rises, can starve the optic nerve of blood, which is bad for glaucoma. What does hiking do? Studies of walking and light endurance exercise in glaucoma patients are reassuring. A 2025 clinical trial of people with primary open-angle glaucoma found that walking at a steady, moderate pace, slow or fast, did not cause a dangerous rise in IOP. In other words, heart-pumping walking kept IOP roughly the same as before the walk. There was a modest increase in IOP only when subjects carried heavy weights, like a load, which suggests glaucoma patients should avoid very heavy backpacks. By contrast, keeping a not too heavy load while hiking was safe. In the same study, ocular perfusion pressure increased moderately after the walk, especially at a brisk pace, meaning that blood flow to the eye actually improved after exercise. Importantly, those OPP gains dropped back to baseline a few minutes after stopping exercise, indicating the change is temporary. Put simply, light to moderate hiking typically lowers glaucoma risk. The research suggests that endurance-type walks tend to keep IOP steady or even slightly lower it, while OPP goes up somewhat. This is likely a good thing, since higher OPP gives the optic nerve more blood supply. In fact, the authors conclude that low-intensity exercise is a safe strategy to improve fitness level in glaucoma patients. Based on this, many eye doctors encourage glaucoma patients to engage in regular moderate exercise, as long as they avoid extreme strain or heavy loads. Of course, every patient is different. If your glaucoma is controlled with medications and you feel healthy, adding hikes to your routine is likely fine, and even protective for your eyes. But if you notice any unusual eye symptoms, like sudden vision changes or eye pain, you should stop and see a doctor. The altitude factor, mixed effects on IOP and eye perfusion. High-altitude hiking, mountaineering, or alpine trekking adds complexity. At altitude, oxygen levels drop, air pressure is low, and sun UV exposure is stronger. Studies on how altitude affects the eyes have mixed findings. Intraocular pressure at altitude. Some studies report that measured IOP actually goes down as altitude rises. For example, a 2020 study of healthy adults hiking on Mont Blanc, up to 3,500 meters, found that average IOP decreased significantly at high camp versus sea level. Other research found no overall change in IOP between lowlanders and people living at 10,000 feet, except that high-altitude men sometimes had slightly higher IOP than lowland men. In practice, mild IOP decreases might result from dehydration or fluid shifts at altitude. But the take-home is that altitude does not consistently raise IOP. Any change tends to be small. Importantly, these measurements can be confounded by corneal thickness changes at altitude, so the true IOP effect is hard to nail down. Ocular perfusion pressure at altitude. This is more concerning. As altitude increases and oxygen levels fall, studies show that ocular perfusion pressure tends to drop. In controlled hypoxia experiments, researchers have found that retinal venous pressure rises while mean arterial pressure might increase only at extreme height. In other words, low oxygen causes blood flow to the retina to struggle. One hypoxia study notes, as hypoxia increases with higher altitude, arterial oxygen saturation and ocular perfusion pressure decreased, and retinal venous pressure increased. Intraocular pressure remained stable. So at altitude, your body is working harder to oxygenate, and the net effect is lower OPP, less blood to the eye, even if IOP itself isn't much higher. In summary, altitude tends to reduce the pressure driving blood to your optic nerve, especially if you go up quickly. In contrast to exercise, which transiently raised OPP, altitude-related hypoxia can underperfuse the eye. This is why staying hydrated and moving up gradually is critical. Beyond pressure, high altitude can also cause eye swelling or even hemorrhages. See below. Extreme altitude retinopathy, retinal bleeding, is rare but documented at very high climbs. We emphasize that most moderate hikes, below 3,000 feet, are usually safe with a normal glaucoma. But at very high altitudes, slow ascent and precautions become important. Benefits versus risks of hiking with glaucoma. Cardiovascular and mental health benefits. Hiking is known to be healthy overall. As a vigorous form of walking, it increases heart rate and aerobic fitness. Over time, this can lower resting blood pressure, improve cholesterol, and decrease the risk of heart disease and diabetes. Being in nature adds mental health perks. Studies show that outdoor exercise reduces anxiety and depression, improves mood, and lowers stress hormones. For example, an integrative review concluded that hiking not only improves cardiovascular function, but also alleviates stress, improves mood, and enhances mental health. Patients often report that a good hike clears their mind and makes them feel more resilient. There is also some evidence that fitter glaucoma patients have slower disease progression. One investigation noted that physically active patients tended to have slower optic nerve damage over time. This suggests the systemic benefits of exercise, better blood flow, lower blood pressure spikes, etc., may indirectly help the eyes. On-the-trail risks. However, hiking also poses specific risks that glaucoma patients should mind. Dehydration. Long hikes, especially in hot or high-altitude environments, can dehydrate you. Dehydration reduces blood volume, which can further lower ocular perfusion pressure. It also thickens the blood and can stress the kidneys and heart. Even mild dehydration might theoretically worsen optic nerve perfusion in glaucoma. In practice, it's best to drink plenty of water before and during the hike. Note, severe dehydration at altitude has been linked to high-altitude retinopathy, retinal bleeding, in some cases. Staying hydrated is one of the key preventive steps for any hiker, glaucoma or not. Sun and UV exposure. The higher you go, the stronger the sun's rays. Ultraviolet UV radiation can damage the eyes over years, increasing the risk of cataracts, retinal damage, and even eyelid skin cancers. A recent review points out that UV exposure is triggered by solar ultraviolet radiation, responsible for many eye diseases, including cataract, melanoma of the eye, photokeratitis, sunburned cornea, and macular degeneration. Therefore, always wear proper sunglasses. Look for 100% UVA, UVB protection, and ideally polarized lenses to reduce glare. Wraparound styles help block sideways light. Some hikers also use photochromic or tinted lenses, amber-brown, that can enhance contrast in hazy or low-light conditions. In any case, protecting eyes from glare and UV is crucial at altitude. Uneven ground and falls. Glaucoma often impairs peripheral or night vision, making it harder to see rocks and holes. This raises trip-fall risk. Data show that people with glaucoma fall more often, and when they do, it's frequently on irregular surfaces. One study found 43% of falls in glaucoma patients were due to tripping, 31% from slipping, and 24% from uneven flooring. Falls can cause serious injuries, e.g. head injury or fractures. To mitigate this, use trekking poles, which greatly enhance stability on rocky or slippery trail. Good hiking shoes with ankle support are important, especially when descending. Take your time. Don't rush down steep or treacherous sections. When footing is uncertain, consider hiring a guide or hiking with a buddy. Overall, be conservative in choosing trails. Steep, loose scree, or very narrow ledges should be approached with caution, especially if your vision is limited. Hiking gear tips for glaucoma patients. Walking poles. As noted, poles help balance and take load off knees. They also let you check ground conditions by touch. Research shows poles can reduce injury and improve walking stability. Even a simple pair of adjustable trekking poles, one in each hand, can make rough trails much safer for anyone with vision issues. UV protective eyewear. Buy sunglasses rated for 100% UVA UVB protection. Large frames or wraparound styles keep more light out. Polarized lenses cut glare off water, snow, and shiny rock surfaces. Some hikers also wear transition contact lenses with UV filter underneath their hats for double protection. If standard dark lenses make spotting shadows too hard, consider wearing contrast-enhancing tints like amber or yellow in low light or early morning conditions. These can improve depth perception in forests or deserts. Just ensure any tinted, shaded glasses do not overly darken your view in shade. Layered clothing and hat. High altitude means colder temps and sun exposure. A wide-brimmed hat with UV coating and a neck gaiter or high-collar shirt can protect eyes from high-angle sun. Also wear sunscreen on nose/under eyes, as ulcers in eyelid margin can aggravate eye conditions. Dress in layers so you don't overheat or chill. Backpack weight. Carry only what you need. A very heavy pack not only strains the body, raising blood pressure and inadvertently IOP, but in our context, it was shown to increase IOP slightly. Aim for a pack weight of 20% of your body weight if possible. Use hip and chest straps to distribute weight evenly. For glaucoma patients, it's wise to avoid lifting or strapping heavy loads. Leave bulky gear or water cache higher up the trail if you can, support staff or pack mule, or use a mule service on multi-day hikes. Hydration and snacks. Carry water and sip often, small, frequent intake. Even mild dehydration can cause headache and reduce oxygen delivery. Keep handy snacks with salt and potassium, sport mix, or electrolyte chews to replace lost salts. At altitude, you may need more water than usual. The air is drier. Skin and eye lubrication. The air is also drier at high altitudes. Eyes can feel gritty. Consider preservative-free artificial tears to moisten eyes if needed. Don't rub your eyes with unclean hands in dusty conditions. Knowledge and companions. Always let someone know your route and expected return. Hiking with a partner is safer. They can help if you stumble or need support. Bring a whistle and headlamp. Altitude acclimatization and hiking strategy. If you plan to trek above 8,000 to 10,000 feet, 2,400 to 3,000 meters, use gradual acclimatization strategies to protect your brain and eyes from hypoxia. The CDC Yellow Book recommends the following ascent guidelines. Ascend gradually. Do not jump from near sea level to high camp in one day. A rule of thumb is to gain no more than about 500 meters, 1,600 feet of sleeping altitude per day once above 3,000 meters, 10,000 feet. For every additional 1,000 meters, 3,300 feet, of elevation gain, plan an extra day to acclimatize. For example, if your base camp is at 2,000 meters, climb to 2,500, 2,700 meters the next night. Only then go higher. Climb high, sleep low. On multi-day routes, it helps to hike up to a higher elevation during the day, but then descend to sleep at a lower camp. This gives your body extra oxygen at rest. Rest days. Include full rest days with only light day hikes. Every few days to allow your body to adjust. Avoid alcohol and overexertion. Alcohol dehydrates and depresses breathing. Save celebratory drinks until after your trek. Don't take sleeping pills or sedatives at altitude. They suppress your breathing at a time you need more oxygen. Medication if needed. At times, doctors prescribe acetazolamide, Diamox, to speed up acclimatization and prevent altitude sickness. Acetazolamide is actually a diuretic that increases breathing rate. If you and your doctor consider it, it also has the side benefit of lowering IOP. It's the same drug used as a glaucoma medicine. However, use only under medical advice because it can have side effects, tingling, increased urination. Know the signs of altitude sickness. Headache, nausea, dizziness, and fatigue are common early signs. If symptoms worsening headache, confusion, breathing fast even at rest, descend immediately to lower altitude. Your eyesight can also blur if you develop retinal swelling. By climbing in a staged manner, you help keep OPP from dropping too quickly. Remember that at 3,000 meters, the available oxygen is about 70% of sea level. Every extra liter of blood, i.e., staying hydrated and moving slowly, helps compensate for that. Conclusion: high altitude go no go checklist. For glaucoma patients, the decision to tackle a high altitude hike is personal and should be made with your eye doctor's input. In general, safe go conditions. Your glaucoma is well controlled, stable pressures on medication, no recent surgery complications. You feel generally fit and have experience with long hikes. You plan a conservative itinerary, gradual ascent, rest days, travel with a partner, and carry the recommended gear: poles, UV sunglasses, hydration. You have emergency contacts and a plan for descent if needed. In these cases, moderate altitude treks, say up to 3,000 meters or around 10,000 feet, can be undertaken carefully, and even higher climbs can be considered with very slow ascents. Warning: think twice. Conditions: you have advanced glaucoma with significant field loss, especially if a single nightfall could mean blindness in one eye or a history of unstable eye pressures. You also have other risk factors, heart-lung disease, that make altitude harder. If the planned trek rapidly gains altitude, e.g., no opportunity to stop and acclimatize, or will traverse very technical terrain, caution is advised. For example, climbing a 5,000 to 6,000 meters peak without staging is generally not advisable for glaucoma patients. No-go conditions: if your glaucoma is uncontrolled, or if you have had recent eye surgery or retinal problems, high-altitude trekking is likely unsafe. Also, avoid hiking at night if vision is poor. If during the hike you develop eye pain, severe headache, visual changes, or feel too unwell to continue, descend immediately. In summary, moderate hiking is usually good for glaucoma, but supplements your plan with extra care. Go prepared with slow pacing uphill, trekking poles, UV-safe eyewear, and snacks water. Add in proper acclimatization, as per CDC tips. Always listen to your body and your doctor. With the right precautions, enjoying the mountains can be possible even for many glaucoma patients, while safeguarding eye health for the long term. All links to sources are available in the text version of this article. You can find the full article at visualfieldtest.com. Thanks for listening. To check your visual field, click the link at the bottom of this article or visit visualfieldtest.com.